Good morning. I'm Dr. Deukmedjian. I'm the CEO and founder of the Deuk Spine Institute here in Florida. Our patient travels to Florida from Wisconsin. Now, he's had neck pain with numbness, tingling, weakness in his left arm. It's been going on for about a year. He found Deuk Spine Institute online. We did a virtual consultation. And diagnosed him with a herniation at C6-C7. C6-C7 is, without a doubt, the hardest disc to get fixed because it's so low in the neck. And God willing, we're going to get down to C6-C7 and fix it today. So enjoy the surgery. This will be a live stream. And I'm going to spend the first few minutes with my team trying to do what's called the access. Access is getting to the place where you need to do surgery. Access, getting access. So you're getting access to the place you need to do surgery. We are going to need a little inline and some straight and inline. So right now our patient is intubated under general anesthesia. He's got muscle relaxation on board. Feels pretty good. I don't know if you can give him a little bit more. We're going to give him just a smidgen more of the muscle relaxer. Then when the muscles are completely relaxed, I'm going to go and place a needle into C6-C7. But to do that, I need my team, and everybody's doing special things, not too hard, okay? But we're going to pull his shoulders down once he's fully relaxed. To pull the shoulders, which are bony, to pull them down, the trapezius muscle has to relax. So Dr. Berndez is going to give this patient maximum relaxation so that we can pull his muscles and stretch them without hurting them. Otherwise, they'll just tighten up reflexively and block us from getting good exposure. So I need maximum muscle relaxation for a very short period of time. And the anesthesiologist is working on that right now. Once he's done, he's going to tell us and we're going to get going. Things will happen pretty quickly once we get this needle in, but I must get the needle into the disc first. If you have questions, feel free to ask. In the meantime, while we're doing this, we're going to show you a nice video on the 30 causes of chronic neck pain. Thanks, Anthony. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Shot. shot. One more shot. AP. Coker. We're just still placing our needle. Shot. It has been difficult, but that is dead center. You guys see that? Dead center. That's perfect. Shot. I need to, get into this disc. Shot. We're almost where I want to be. Perfect. All right, now we're in. Let's just take our time here. And you got the window down. All right, so let's go ahead and look at just 2 millimeters more north so we can verify C2. Perfect. Let's count. We're going to count for you folks on the lateral x-ray. 2, 3, 4, 5, C6, C7. We are at C6, C7 disc. That's exactly where we want to be. Everyone agree? We're fixing C6-7 herniation. You can see the endotracheal tube on the lateral view. Jordan will show you with the, are you on the x-ray there, Anthony?
Yes, I am.
You can see the endotracheal tube, which is feeding him oxygen and removing carbon dioxide and gases. And then you got the esophageal temperature probe in the esophagus. You can see the needle at the bottom running into the disc through the front. At this point, I'm going to do what's called a discogram. This is not a type of dance move. Disco. This is basically injecting dye into the disc. Shot. There we go. Look at that. Look at that dye. Shot. Beautiful. All right, try to get a better picture of the disc. We want to see the back of it. Shot. All right, well, sorry. You can see the dye is leaking out through the back of the disc where the tear is. That tear is traumatic tear. Shot. All right. Yeah, you can leave that. That's fine. Shot. Try to close it down a little bit, maybe, Jordan, top to bottom. There you go. Let's see if we can't get a better picture. That's a better picture. Good job. All right, any questions?
No questions.
Let's show the audience how a disc herniation in the cervical spine at C6-7 can cause so much pain and symptoms for the patient. Meanwhile, I'm going to make an incision that's only 4 millimeters. This is a bloodless surgery. We'll lose a few drops of blood and that's it.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right. We are using our lateral view to guide the dilator, which spreads the tissues under the skin instead of cutting them. The dilator is now in front of the spine, and let's get a quick AP view. We've lost 1 drop of blood. That's all we're going to lose for this surgery, folks. 1 drop of blood. Shot. All right, look at that. Show us the tip of the dilator. Look at the x-ray, Anthony. Go to the x-ray.
I'm there.
There's the guide wire coming out of the tip, still inside the disc. You got the dilator tip in front of the disc at the anterior annulus. You got the dilator shaft all the way up to me. And then you got the dye within the disc. Look at that. The dye is leaking out through a tear on the right side and the left side. And the dye is going out the tear in the back of the disc where the herniation is. And it's getting on the nerve root. And that's why you're able to see the nerve root with the dye wrapped around it. All right, thank you. We're going to go back to a lateral view. Remember, we've lost now 1 drop of blood. Let's get inline traction. Stabilize the neck. We're going to go ahead and advance the dilator. Shot. Try to give me the best view you can. In case you're wondering why my gloves are black, I'm using what are called radiation gloves. That's perfect, Jordan. Nice job. Show the herniation there. You can actually see the herniation in that there picture. You see the x-ray there? That's
yes,
the
we do.
herniation right there. It's huge. Okay? That's what we're going to go get. You can see the tear. Show the tear right there. Show that tear. Look at the tear in the back of the disc. That's an annular tear. That's where all the neck pain and arm symptoms come from, that tear. And look how the dilator is going right into the tear. See that? Right towards the herniation. Right now, the dilator is at the back of the disc, right where the herniation is. Perfect. We've lost literally 2 drops of blood. 1, 2. That's it. The incision is about 5 millimeters. It was a little heavy-handed today. 5 millimeters, we're fixing his herniation. This Deuk Spine Institute is the only place in the world you can get this laser surgery done. All the other doctors are going to recommend last year's type of surgery, fusion or artificial disc. But if you want the best in the world, you come to Deuk Spine. This patient did. He traveled all the way from Wisconsin. Shot? All right, we got to watch the tip of the dilator to make sure it doesn't advance into the spinal canal. So that's what Luis is doing for me. Sorry. And I'm going to continue to try to advance the tube. You guys see the tube? Jordan, show them the tube. Show them the front of the tube. There's the front of the tube sliding along the dilator. Now, it's that tube, shot, where we're going to do the entire surgery through that tube. Little inline traction. Right now, shot. Shot. Beautiful. Almost there. Just about done. Perfect. All right. Shot. All right, perfect. I'll tell you an interesting story. I got a call this weekend on Saturday from a patient who had the laser surgery done at L45, L5S1 in Virginia. And he said, I'm in so much pain right now, doc. I did his surgery 1 year ago. 1 year ago, he had the laser surgery. And he was doing great, no problems. Then he calls me and says, I got horrible pain. I think I re-herniated my disc. So we said, come in. Let's get an MRI, which we just did this morning. And look for a re-herniation. Because he's an active guy. He owns an HVAC company. So I just looked at his MRI, and I'm looking, and I don't see any re-herniation at all. But then I started to see the cause of his pain. It turned out he tore his muscle. He just was doing too much, and he ripped his muscle in his back. So he's got a muscle tear, not a re-herniation. And he doesn't need surgery. He came here prepared to have another surgery done. I said, you don't need surgery. It's not going to fix your problem. Let's just give your back some time to heal. So he's going home a happy man. By the way, there's the inflammation right there. You see the pink stuff? You guys saw the video earlier on how a herniated disc causes neck pain, and it's all because of inflammation, which, by the way, is pink in the human body, a pink color. Makes it easy to see. That's how I made this discovery 20 years ago. When I started doing endoscopic surgery, I started to see the inflammation in the back of the disc, and I realized that that was the cause of neck pain. So that's how I made the discovery myself. I was the first to discover it. There's another piece of herniation right there. You guys see the herniation right there coming out? We are floating it out of the tube. If you have questions, feel free to type them up. I'll take them in a moment. In the meantime, Anthony, will you show the audience how we do the Deuk laser disc repair to remove herniations in the neck at C5-6, C6-7, and C4-5, and how it cures neck pain as well as arm symptoms?
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Back. We are halfway done fixing this disc at C6-C7. It is not an easy one to get to. It took a lot of special maneuvering in the beginning of surgery to get our dilator into the back of this disc and get us where we need to be to fix this disc. That's a bone spur right there. I get a lot of people asking me, can you get rid of bone spurs with the laser? The answer is yes, very carefully. All right. So this is the back of the disc. There's the tear. Look at that. Look at the tear right there. You guys see it? That's the tear where the herniation went out. That is a tear in something called the posterior longitudinal ligament. That's what this is. I'm opening it right now with the laser. I am opening the posterior longitudinal ligament behind the C6-C7 disc. And what do you know? Look at all the herniation back there. There's a lot of it just tucked away, pushing on his spinal cord. We don't want that. We don't like anything pushing on spinal cords. That's bad. But look at how we can fix this, folks, without taking the entire disc out and doing ACDF. ACDF is no longer necessary to fix a herniated disc. Why? Because we have the Deuk laser disc repair. You have the Deuk laser disc repair. Here come the herniations. All this scar tissue is holding them down. And here they come. Ready? Just releasing the last of the scar tissue at 0.5 millimeter at a time. Look at that, 0.5 millimeter at a time. And there it is. They've already come out. Boom, there's some more. Look at all that. That's amazing. In all my years of doing ACDF, and I've done 1,000 ACDFs in my career, I have never seen something so elegant as this surgery. Literally peeling off the PLL and scar tissue at 0.5 millimeter at a time. That's the control we have with the laser. That's amazing. Basically just did an excavation of the herniation. Any questions from the audience?
Yes, we have a question from Rick on YouTube.
Hi Rick on YouTube, welcome to our stream.
Dr. Deuk,
Yes.
spine surgeries have developed over the years. Are you working on procedures better or safer than what we're seeing right now?
Great question. Well, we are always looking for ways to make surgery safer and better for the patient. And that's a great question. The answer is yes. Deuk Spine is always looking for the next generation of treatment. And the reality is, look at this piece of herniation right here. It's all scarred up, calcified. Look at the gold color on it. I'm just melting it down with the laser. It is the safest treatment there is. It's amazing. To answer your question, the simple answer is yes. Deuk Spine Institute is leading the world in advanced spine surgery. Now, are we looking at future treatments? Absolutely. As a matter of fact, to understand the need for future treatments, you really first have to understand the diseases that are affecting human beings that need treatment, right? And the herniated disc is by far the most common disease, 2 minutes, that affects the spine that needs treatment, okay? The other conditions that need treatment are facet pain, and which causes neck pain, but also restricts movement. So we have facet pain, we have herniated disc, I'm getting stuck a little bit, Luis. And we have in the lower back sacroiliac joint pain. We have piriformis pain. So you got four common causes of back pain in the lower back, and you have two common causes of neck pain, the disc and the facet. In his case, it wasn't just neck pain, he was having radiculopathy, which is nerve symptoms due to the herniation. Okay? I got about a minute left. So to be able to discover, create, pioneer new technology, you first have to understand the condition you're trying to fix. And for many, many years, humans medicine didn't understand it. We didn't understand what was wrong. Like, how do people get neck pain? We couldn't figure it out. And now we know. So once you know the cause, then you can come up with a treatment. Like diabetes, for example. Number one medical problem in the world, probably, that is a chronic condition that is still not curable, but nobody knows why people get diabetes, right? We don't know why. Why do people get diabetes? We still don't have the answer as to what causes it. We just know things about it, like the islet cells die, they stop producing insulin, or our bodies become resistant to the insulin. But we don't have an understanding as to the basis, as to why that's happening. So we still have so many unanswered questions in medicine that need answering. But the only way we're going to come up with the best answers, the most advanced answers, is when we understand the cause of the disease. And I figured out the cause of pain, back pain, neck pain, what it comes from. I figured it out over the years, and I published it and told you guys about it so that you can all see it. Now, people say to you, why don't you do peer review publications? I do have peer review I have 11, or I have 12 or 13 peer review publications. But the truth is, if you're peer review publishing, you're publishing in a journal that the general public doesn't have access to. Okay? These journals that we publish in 30 seconds, people can't get, normal people, regular people can't get access to those journals. They're only available through paying money, subscription, and usually to doctors. So I wanted to publish in a place where everybody could see. There's a big piece of herniation right there. Let's grab that out. I think that may be our last piece right there. Look at it, it's so big, it's having a hard time coming out, but I'm gonna go get it with my grabber. That's why this surgery is amazing. For the fine work, you use the laser. For the big work, like removing a piece of herniation, you use the grabber. Let's get a tape measure. We're pretty much done. Look at that, folks. You see that? Anthony? That piece of herniation is 5 millimeters wide. You see that?
Yeah, I see it.
Now, you may say, oh, that's the herniation. It's not the herniation. That's part of the herniation. We're done. Okay? It's part of the herniation. We're done. We'll take any more questions, but I want to show you. We had 0 bleeding. We lost 2 drops of blood the whole surgery. 2 drops. 1 milliliter of blood, which is like normally the smallest amount that's measurable in surgery, 1 ml, is 20 drops. We lost 2 drops. So we are at, what, 1/10 of an ml? Like, that's nothing. And the incision is 5 millimeters. Normally 4, but I was a little heavy-handed today. You guys see that? 5 millimeter incision?
Yes, we do.
We're going to put a Band-Aid. Now, if he had gone and had surgery where he comes from in Wisconsin, the surgeons wanted to fuse him, do an ACDF, anterior cervical discectomy and fusion. And he said, no, 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 I don't want that. He was right. And so he and his wife prayed about it. They came to Deuk Spine, and here we are. We just fixed his herniation. Any other questions from the audience? How many questions do you have?
2 questions from the same person.
Sure.
So Sean on YouTube I love your work. I've been trying to get there for years.
Hold on one second. Take the camera off the patient's face because we're going to take the drapes off.
Okay.
Go on.
Okay.
Love your work. Been trying to get there for a few years. Sean on YouTube. Thank you, Sean.
But just haven't been able to afford it. I know at one point you are accepting insurance. What is the status with that?
Great question. So, Sean, it took me 18 years to get the insurance paperwork right. You know, we have all the peer-reviewed publications. We have prior judges ruling that our procedure is medically necessary, not experimental like the insurance companies want to say it is to get out of paying for it. We even have lawyers, they're the best lawyers in the country to fight the insurance companies to get them to pay. And I've got now 80 surgeries, 80, that the patients paid between $20,000 and $50,000 out of their pocket for the surgery, right? And now I've got 80 surgeries ripe for litigation, meaning that we've exhausted the appeal process. We've created the perfect administrative record, which is what will become evidence when the judge hears the case, because it's an ERISA case in federal court. And now we're going to the patients and saying, hey, we want to sue the insurance company because they're not paying. And guess what? Out of 6 of the first patients, 3 of them said, oh, we really don't want to sue our insurance company. We don't mind. We don't want our money back. It's like, are you kidding me? It's like at the end of all this effort, and now I got people who don't understand, we need to sue your insurance company, get them to change the policy so they could cover this for everybody. And we went through this before, trust me. So they know about it, but it's like God has thrown obstacle after obstacle after obstacle after obstacle in my path over the last 20 years. And I'm not giving up. We still have some patients willing to do it, but it's like a bottleneck effect, you know? It's like you think, oh, I've got thousands of patients. We can go get them, these insurance companies, but they make it so hard. And then, of course, at the end, patients don't want to sue their insurance company, but they have to. That's the only way you're going to get these laws to change and get coverage, because the insurance companies just deny everything new and don't want to pay for anything. So that's where we are. Any other questions?
No questions.
She has a herniated disc in her lower back, L5S1, left leg pain, back pain, can't even get out of bed, and she's got a piriformis, so we're going to fix both. Thanks for joining us. And good morning, I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who traveled from California with a problem in his neck. He's been having pain, it radiates down into his left arm. He has some other issues as well, like pinched nerves in the elbow and palm, which he's treating in California. But the herniated discs at 5, 6, 7, we did the Deuk laser disc repair yesterday. You can see me going in with the endoscope and the laser. It's all done with a 4mm incision, bloodless surgery, and outpatient. And here he is less than 24 hours later, and he wants to share his story with you. So go ahead.
Okay, so the first thing I want to do is give Dr. Deuk a joke that I wrote last night. He's going to understand this. We might have to look some of these things up. A neurosurgeon was performing several radiofrequency ablations on patients when he started hearing loud shouts and screams in the recovery room. Shocked, he walked into the room to see what happened. The nurse ran up to him. Doctor, things got pretty heated up for a while, but no one had the nerve to say anything. That one over there seems especially nerveless. All right, so I got him to laugh.
I like
Good stuff.
it.
Okay.
I like it.
You know, just a little
Nerveless instead of
dad
nervous.
humor there. Good
I love
stuff.
it. I love it. I love it.
What happened for me was ever since I was a kid, I was the young kid that fell off the high chair when I was 2 years old, fell down the staircase when I was 4, got tripped, hit the back of the sandbox at 6. I went in the military, I parachuted out of planes, hit my head more than once with a Kevlar helmet, then served in the military wearing Kevlar helmets, sometimes banging my head against just heavy artillery pieces. Sometimes I didn't have my helmet on. Sometimes just the weight of the helmet was hurting my neck and my back.
That part about banging your head in the plane against heavy artillery pieces, sometimes you hear in the military like a helicopter went down, right? Suddenly exploded, went down. Now I know why.
Well, you know, I mean, people will say, why would you jump out of a perfectly normal airplane?
Right?
But, you know, let me just tell you, low contour flying by a sea, some of the jets there makes things a little bit tough. And then after that, what I started to notice, I started to develop where my muscles in the back just became really severely tense and stressed out. I kind of thought it was work, and otherwise. And then when I'd go to things like the dentist and I'd lean my head back, my entire left arm would just start tingling and sparks shooting out like crazy. And when I got back up, things were better. But then I went on a trip back in early May, and then it was happening all the time. At that point, I got an MRI done. You know, obviously at that point, I went to my primary care and I had options. There were 5 options, really, if you think about it. One was do nothing, just, hey, I'm getting older, just deal with it. You know, stop being a baby and just, you know, life goes on. Number 2, maybe seek physical therapy or chiropractic care, which I did, and it helped. For some things, I had really bad posture. That was one of my issues, but it wasn't taking away the problems that I was having with the tingling, doc. So then I started to seek out medical expertise in Los Angeles. First choice was full disc replacement for both of the discs. The way I was thinking about disc replacement was, it's kind of like having a car. The tires are halfway worn down. You're having problems with one of the tires in the back, and you decide to replace it with a bigger tire that's different tread, different braking system. Now, it's gonna work if you're riding on a regular road or highway, but it's something different and that's working there, and it was never made for the car.
You'd be replacing it not with a different tire, but a metal tire.
Yeah, a metal tire, even worse,
like
exactly.
a tank tread.
Yeah, and then you can't do MRIs, or you gotta find the ceramic one, which you can't. Okay, so that was disc replacement. That didn't sound attractive. ACDF, I've got some dear friends that have done ACDF. Problem there was, I was thinking of that same car analogy. Now you got the rear tires are locked in. They only go straight. They brake at the same time. The suspensions are the same, and only the front 2 are moving around. And I was worried about what is the effect on the disc above and below. And my mom had this problem. She had lumbar fusion with rods in her back, and then she ended up having lumbar fusion in the upper ones when she was alive, and that poor woman went through a lot of pain for it. So I was figuring, hey, look, I'm a guy that works in technology. There's got to be a better solution to this. And I just started doing research online. There's got to be someone. And I was very grateful that I came across Deuk, a spine clinic. I must have watched about 15 of his videos. I started to watch some of the procedures before I started freaking out, just looking at that stuff, just not my thing. I'll stay in technology. But one of the things I found immediately that endeared me to me, Dr. Deukmedjian, was the people that sat in this chair. You could just see what he was doing and how he was helping them. And I knew I'd found the right person that could help me. It was that easy, Doc.
Awesome.
You know?
Well, you persevered. You were uncompromising. You wouldn't settle for what you were being told, which is, let's go in and put metal in your neck. And we've talked about this. You're aware that there's a big problem in spine with the industry that produces metal pushing these implants on the patients through the surgeons. The surgeons are the ones that recommend it, and the surgeons are rewarded financially in several ways for doing that. Problem is, it is not the best treatment. It used to be the best treatment, but now we've made progress. We do the laser surgery. That is the best treatment, and you've had it. I told you before surgery, you know, it may not work because you got some bone spurs, but you told me this morning that you don't have that pain anymore.
Yeah, I do not. And I can't even describe it because it's a sort of an ease that I haven't had probably for more than 10 years, Doc, at least. I don't even know how long I've been dealing with these, and again, the electroshock and everything else. It's been a blessing, and I'm certainly having you take care of me. And I'll tell you what, Doc, you know, one of the things I'm going to try to do is see, you know, what can we do with the government? I mean, you know, it doesn't matter what side of the aisle you're on, but maybe there's ways to talk to folks in the government to get more attention to these kinds of things. Because what I'm afraid of, I found you because I looked really hard and I did did all the research. There's a lot of wonderful people out there that they just don't know. They're really limited on their options.
Of course. The problem is the absolute truth, which people don't want to hear, is the government is controlled by big business.
Yeah.
And there is no business in the world bigger than insurance companies. They are the most powerful. They've brought the pharmaceutical industry to its knees. They've brought the medical industry to its knees. And the insurance companies just sit in the back. They take your money every month with premium payments, and then they don't pay their bills. And they keep the money and then become richer and richer and more powerful. The insurance companies do not want my surgeries out there because they work and they know what's going to happen. Everybody is going to want it. And that is going to be like, what do you call it? A run on the...
Yeah, run on the market kind of thing. Exactly.
Yeah, everyone's going to want it. They're going to get all these bills and they're going to have to pay them. And it's going to be in the center of attention. All these people are going to be complaining they're not paying the bills. Insurance companies do not want new technologies that work. They want patients to only have old technology that doesn't work, that they're afraid of, because there's nothing better for an insurance company than a patient who's scared to have a medical treatment. The patient won't get it done. There won't be a bill for the insurance company to pay. They get to keep the money, and they don't have to be the bad guy denying payment.
Yeah, and Doctor, you were saying also that overseas folks have embraced technologies like what you're able to provide, right?
That's correct. Yeah, if you go to China, India, Korea, they don't do much fusion. They do mostly endoscopic surgery because it's better. And in the United States, there's only probably 5 surgeons in the whole United States that do true endoscopic surgery. Some of them advertise it, but they don't actually do it. A lot that needs to happen. We're probably 30 to 50 years ahead of the rest of the spine surgeons out there in terms of treating spine issues that are degenerative and joint issues that are degenerative. But I appreciate you sharing your perspective.
Thanks, Doc. Appreciate it.
Thank you
so
sir.
much.
Congratulations.
I appreciate it. Thank you.